Mabuhay future nurses! Welcome to Pediatric Nursing 101 with me, your student nurse, Edmond. In this video, I will be performing the newborn screening. Newborn screening is a test used, is a procedure that is done within the 24 hours of life of the infant in order to know if there is the presence of any genetic or metabolic disorders like phenylketonuria, galactosemia, congenital hyperplasia, congenital hypothyroidism, the maple syrup disease, and any other metabolic diseases that is present. So with this, we will be able to determine if there is the presence of these diseases to the baby, and you'll be able to give the proper treatment to the baby. So before doing the procedure, of course, we'll be asking the identity of the client and verify the client's identity as well as to introduce ourselves. Okay? So, good morning po, ma'am. Ako po si Edmond M. Bigata, student nurse po ako from Camarines Sur Polytechnic Colleges. Ma'am, pwede ko po bang malaman po ang pangalan po ng baby? Okay po. So, ang mangyayari po ngayon, ma'am, ay magkakandak po tayo ng newborn screening. Napaka-importante po ng newborn screening para po malaman natin kung may sakit po ba ang anak po natin, kung mayroon po ba siyang genetic or metabolic disorders. Ngayon po, kapag po nalaman natin na meron, ay mabibigyan po natin siya ng karampatang treatment at kung ano po ang magagawin ni baby habang lumalaki. So, ang mangyayari po ngayon, may kukuha po ako ng blood sample dito po sa may heel po ni baby. Ipipray ko po siya using a needle para po makakuha ako ng blood sample. Ang gagawin naman po natin ang best natin para po magawa natin ng maayos itong procedure po kay baby. At tanong ko lang po, ma'am, napadede na po ba si baby? Nagpa-breastfeed na po ba siya? Sige po. Okay po, ma'am. Now, after we introduce ourselves and verify the client's identity, we will now be preparing the equipment. The equipments that we will be using for the procedure are the following. After getting a sterile tray, we will be putting a pair of sterile gloves, a gauze pad, sterile gauze pad, a cotton ball dipped in alcohol, a needle that will be serving as a substitute for our lancet, the filter paper, which is filled out with accurate information of the infant, as well as the expiration of the filter paper was also checked. A bowl that contains warm water, which we'll be using to warm the heel of the patient before doing the procedure, and of course an alcohol that we will be using for sanitation. After we explain the procedure to the client, we will now be practicing proper hand washing. We will be cleaning our hands vigorously using alcohol. Now that we already washed our hands vigorously, we will be putting our sterile gloves, starting with our dominant hand. So it's okay kung hindi siya masyadong maayos. We will be fixing it after we put the next glove. Okay, now we will be fixing it. Now that we've already put the sterile gloves, we will now be positioning the patient. So, the feet of the infant should be lower than the heart to facilitate circulation in the periphery or in the lower extremities. So, okay. Now that the patient's feet is already positioned below the heart, we will now be warming the surface of the heel, which is this part, using a warm water. We will be doing this for 3 to 4 minutes. We will be doing this for 3 minutes. Okay. So the reason why we do the warming of the feet of the baby before doing the procedure is that we have to remember that the cardiovascular system of a newborn is still sluggish, meaning the circulation on the periphery is not fully developed, and that kind of sluggishness causes the acrocyanotic color of the baby. So in order for us to get a good blood and a good blood flow, we have to warm the surface of the feet, because warm water facilitates vasoconstriction and enables good blood flow. Okay, so now let us assume that the 3 minutes is over and we've already warmed the surface of the heel of the baby. We will be letting it dry. Okay, now let us assume that the feet of the baby was already dry. What we will be doing now is we will be pricking the heel of the baby using a needle. So when we prick the heel of the baby, we should prick on the medial side or in the lateral side of the heel. So that would be in this part. That would be in this part or in this part, okay? So now we will be pricking it. And we have to remember that the first blood flow that will come out on the periphery or in the heel of the baby should be wiped off using a sterile gauze. Now, the second drop of blood, that would be the time that we will be using our filter paper. So we have to remember that we should not touch the bottom part of the filter needle because it's sterile. We have to just touch here on the upper portion and let the blood touch the first circle. And do the same process on the second circle, third circle, fourth circle, until we finish the fifth circle. We have to remember that when filling the filter paper with blood, we have to do it in single application. Meaning, we are not allowed to put 2 drops of blood sa isang circle because it might screw the results. So, we have to put only a single application of the blood of the baby in one circle only, and then another single application of the blood in the next circle. Okay? So now that we're done, let us say for an instance that we're done filling all the circles with blood, we will be applying pressure to the feet of the baby. So we will be positioning the feet of the baby higher than the heart because it provides a cessation of the bleeding. And we will be using a cotton ball with alcohol. There. Okay. Now we'll be going the baby back to its position. Now after filling out the filter paper, we will be drying it horizontally. We will be air drying this one horizontally. For at least 3 to 4 hours at an ambient temperature. and away from direct sunlight and moving surfaces of air. Blood spots on the filter paper should not be heated, stocked, and allowed to touch other surfaces during the drying process because it may promote contamination. So once na na-contaminate siya, there is a possibility that microorganisms such as bacteria and parasites will be flourishing on the blood and might screw the results and might create false positive results of the baby. So it is better talaga na we will be handling the filter paper with blood with our care. So this should not be stocked. Hindi siya pwedeng pagpatung-patungin habang hindi pa siya tuyo. Hindi siya pwedeng ilagay sa envelope na isisend doon sa na ibibigay sa courier na hindi pa siya tuyo. We have to make sure that the blood on the bottom part is already dry before putting it inside the envelope. In order for us to elicit an accurate result. Now, the completed ENBS filter paper will be sent into the courier. And the courier will be the one to deliver the in the laboratory where the newborn screening will happen. And we have to make sure that all of the information written here is verified and accurate. Now, once the parent did not agree to do newborn screening to his or her child, we must accomplish 3 copies of refusal form, and we will be faxing the copy and the sign of the refusal form into the ENBS program, and 1 copy will stay in the hospital for the record. Now, we will be mailing the completed form for testing the laboratory within 24 hours of collection. So, yung results ng newborn screening will come out after 7 working days. Now, if positive yung baby mo with some certain conditions like galactosemia, fetal ketonuria, G6PD deficiency, within that 7-day period, tatawag yung laboratory informing you that your baby was positive with these disorders. And the black and white copy of the results will just be sent afterwards. But if the laboratory did not call you within 7 working days, it means that the baby is normal and doesn't need any interventions because he or she doesn't possess any of these disorders. So that's how we do the newborn screening, which is a very important procedure for a newborn. So once again, thank you and good night.